Vanakkam, welcome to Kauvery Hospital's health message. I'm Dr. Sivaraja Thandeswaran, stroke or neurovascular consultant at Kauvery. Today I'm going to talk about migraine and headaches. Migraine and headaches are very common. 1 in 8 people in the world suffer with one of these headaches, and there are 50 different types of headaches. Out of them, the commonest is tension headache. Next common is migraine. Then we have cluster headaches and other autonomic cephalgias. Tension headache is often due to stress, sitting in same posture or working in a very closed environment. Often it begins as a headache over the forehead here, or a craniocaudal situation where it is more in the neck and can even go down to your shoulders and can be on one side of the head. Usually does not last more than few minutes, maximum of half an hour, but it often can come back very frequently. Migraine headaches are well known, often causes very severe headaches, often to one side, and may last more than many hours, even up to a day or two. Many people with migraine often suffer with a lot of other associated symptoms like a prodrome, which may be there the day before the migraine, in a form of excessive yawning, being tired, cold hands and feet. Sometimes they may have a craving for food also. Once the headache starts, some people also develop what we call a migraine. Nearly 1 in 5 of migrainists suffer with aura. It can be in the form of visual scintillations or scotoma, that is dimming of vision, or there is a lot of zigzag lines or bright sparks coming in front of your vision. In some people it may be entirely different neurological event, like inability to talk, or it can be due to paralysis on one side or numbness on one side. And it can also be due to a severe form of vertigo before the headache starts. Once the headache starts, it can be very severe and debilitating. Often people have very severe sensitivity to light, sound, certain smell and taste. Once the headache is resolved, often people have a intense feeling of tiredness. Many people have to pass urine several times, as during the prodrome and the aura and headache phase, people tend to have accumulated a lot of fluid in the body. Migraine can happen more frequently. Some people have more than 2 attacks a day, or maybe 2 to 3 attacks a week. And if that is the case, then we would discuss with you to have preventive medicines on top of medicines that can abort the headache when the headache is ongoing. There are a lot of preventers that we can choose, and common ones are beta blockers, and other common ones are certain medicines that we use for depression, which can be used at night time. The other common headache, which is the tension headache, is often treated similarly in a way to migraine, but it also involves a lot of psychological support with stress adjustment, managing your muscle strength in the back and your neck, and also doing a lot of exercises. Both migraine and tension headache respond better with a better lifestyle, proper sleep, a good routine with your food, drinking plenty of fluids, and avoiding dehydration as much as you can. Sleep is a very common factor that can trigger migraine and tension headache. Those who sleep very late, especially with the current social media age, people tend to use their mobile phones, tablets and TV and rest of the social media very late into the night, and often it can worsen one's migraine or tension headache. The other common scenario where we get confused with these two types of headaches is what we call autonomic cephalgias, where patients often have entirely different type of headache, but often not getting they're not getting the right treatment because they're not getting diagnosed correctly. These headaches are often due to changes in blood flow around the brain and around the nerve that carries sensation from the face and the neck into the brain. They often have a severe tearing type of pain behind the eyes. It can last many minutes, and it can come in clusters. So you may have 10 to 20 painful attacks, which goes away and comes back after several hours, and it may also cluster for several days only to go back and come again after weeks or months. A minor form of that is also called hemicrania, where you may feel pinprick kind of pain over your scalp, which can last a few seconds to many minutes, and often you may have up 40 to 50 attacks in a day. There are better treatments that we choose for these kind of headaches, and we can only choose those medicines only if we can get the story right from you. So seeing the right person and getting the right diagnosis is very important in treating a headache. You may want to know, how are these headaches diagnosed? So all headaches, including migraine and other autonomic cephalgias, are purely diagnosed with your story and a normal clinical exam. So migraines are commonly diagnosed based on the clinical story, or in fact for any other headache types. It's purely based on the clinical history and having a normal neurological exam. In a very small proportion of patients, we may need to do further tests, including blood tests to check for thyroid dysfunction, hemoglobin, because anemia can worsen headaches, so is the case with the thyroid dysfunction. Very rarely we do brain scans, and we reserve this only for those whose headaches are not getting better with first-line treatment. Once we know the story from yourself, then we can decipher what type of headache it is and then initiate the first-line treatment with preventive drugs. If your parent has migraine, there's a 50% chance it is going to be passed down to you. If both your parents have headache, it's nearly 80% chance that you will also have migraine. And as I said, migraine is hereditary in nature. The other types of headaches are not so. Apart from the headaches that I just mentioned, we also deal with completely different set of headaches called secondary headaches, wherein the headache is due to a particular problem in the body. For example, it may be a bleed in the brain, or it could be a growth, abnormal growth in the brain, or it could also be due to a abnormal blood vessel problem like aneurysm in the brain. These headaches are much serious and often present with very severe types of headaches which are out of character to your normal headaches. If that is the case, it is better to come and see us urgently through our emergency room. For other types of chronic headaches, we usually deal it in our outpatient department. Hope this information has been useful, and in Kauvery Headache and Migraine Center, we offer comprehensive workup and care and long-term support for those who suffer with headaches. Thank you.